Science and technology have advanced tremendously, but with that advance has come enormous complexity in the creation and the delivery of value. So let's look at one disease and just use that as an example for so many other situations with which you're familiar. Back in 1964, if a woman was diagnosed with breast cancer, her survival rate was 50, maybe 60%. And the reason was the survival rate was so poor was the science and technology of diagnosis and treatment was incredibly poor. It was largely, do you have a lump? Can we spot it on an x-ray? If we spot it on an x-ray, is surgery feasible? And if it's feasible, it's the same surgery, radical mastectomy. Well, today, if a woman is diagnosed with breast cancer, she's not diagnosed with breast cancer. She's diagnosed with one of many, many different diseases, all of which happen to fall under the umbrella of breast cancer. Each disease has its own genetic mutation. It has its own hereditary predisposition. It has its own environmental trigger. It has its own presentation, which may differ patient to patient. There's a lot of different diseases. Now, the good news is the science and technology has advanced so far that you can actually determine and make distinctions between these different diseases. It's not just examination and x-ray now. You've got mammography, you've got CT scan, MRI scan. You can do a biopsy and do a genetic screening. You can do blood work, all sorts of other tests to pinpoint exactly which disease a patient has. Now, that's good news too. It'd be one thing if you just knew what the disease is, but you can treat it. And the reason you can treat it is because, again, the science and technology has advanced fabulously well. But where's the difficulty here? And there is difficulty. It's designing and operating the system through which care gets delivered. See, back in 1964, what did you worry about? Surgery, always of the same type. Nursing, always of the same type. Now what do you have to worry about? All these many, many more specialties, all these different functions, all these different disciplines which have to come together into a system. And then the next patient comes along and you have to reconfigure them and reconfigure them again and again and again every time a patient shows up. Now here's the thing. Putting that system together, there's a process behind that. Putting it together again, there's a process behind that. And you know, getting that process right on the first try, it's just not going to happen. It comes back to this necessity of innovation.